Hello, I'm Cindy with Wisconsin Voices for Recovery, and this is Speak Out on Stigma. Today we'll be hearing from Aria from UW-Madison Population Health Institute. Hi, Aria, how are you today?
Good morning, Cindy. I'm good. How are you?
Good, I'm good. So tell me, what do you think makes people use stigmatizing language?
Thank you for asking me these questions. And I just wanted to start by sharing that this is my kind of personal view grounded in research that I've done and experiences I've had. Um, so I People use stigmatizing language in my experience when they don't have a personal connection or they don't know that what they're doing is causing harm. And some people do know that they're doing, but I think most people haven't had a model or an experience that helps them relate and helps them learn to use either a kinder tone, a more open tone, and language that is more inclusive and less exclusive. So I think once we learn better language to use, then it's our job to model it. And if we are in a relationship where we're comfortable and it's safe for us to do so, to also say, call our friends or colleagues in and say, hey, I noticed this happened. Let's do this instead because this is a more open way to do it. Um, so I think once people have those experiences that bring them closer to a person or a topic of ideas, then that really helps them take it more to heart and kind of carry more humanity with that. So I've definitely heard and learned from other folks that, especially in academic or what we would say are like highly professional settings, that there is a lot of underlying shame and stigma that people who may have lived experience bring, and people aren't always disclosing. So it's always good to use the most inclusive approach that we can, and make it really clear that we all have a lot to learn from each other, no matter what is the letters behind our name or the experience we have, because we can really elevate each other when we listen.
Yeah, absolutely. Thanks for that. And I like how you spoke to the additional. So we talk a lot about educating people on stigmatizing language, but you really spoke to the modeling aspect of that. And so that's taking that information and applying it and educating through example. And I think that's really important.
Thank you. Yeah, we do a lot of kind of surveys and interviews in our line of work in population health. And one of the things we try to do when we're able is adapt language in the tools that we use so that it is more appropriate. And that will be different for all groups. Um,
That's great. And what can be done to address stigma in the community, systemically, and within the structures that people with substance use disorders encounter?
yeah, that's a big one to unpack. And I think I'll speak again to kind of my professional role in doing evaluations. We can really bring our whole like humanity to the base of our work. And so again, I think that means that when we're in meetings with folks, when we're um, setting up projects, making sure that we are really leaning into people first. So I've had, I think, the privilege of working with a lot of very courageous folks who are very open and doing a lot of very forward work to make sure that people are recognized, respected, and have space to really just show up and share. So, again, speaking to that shame and that stigma, people who are in highly professional roles or highly visible roles speaking about their experience and still, you know, they're just people. We're all just people. And I watched many of the other videos and I heard a lot of folks say, like, we are people and want to be treated as such. And so, coming into the room and making sure that our work reflects people. And I think that's easy to get lost when we're working with data and spreadsheets, but it all comes from people. And so, really, really grounding in that. And again, using language as a value. So when we're putting out reports or communication, making sure that the story we're telling is respectful and honoring of the work is being done. So sometimes, and we hope that this is the case, we're able to show that things are changing in positive ways with the work that people are doing. And sometimes that won't be the case, but really always honoring like who is reading this, who is this from, and trying to share the data story in that respectful way. And I wanted to say that kind of the population level assessment is something that I think is unique in my work. I think there's a lot of folks who are doing very important and individual based work, like treatment, recovery, you're working one on one. And then my role is kind of zoomed out. So seeing what's happening at a large population level. You know, things are improving for people. The work people are doing is impacting kind of in a large scope. So even if one person is having a really rough experience and they're not having personal changes that are positive, there's many other people who are making positive incremental change, which is what I think everybody hopes to see, that the work we're doing and the relationships we're in create positive change. So I think that's an important thing, that even without lived experience or without kind of being in that role on the ground, I think it's really important that we're able to see kind of a bird's eye view of things.
Great, thanks so much for sharing that perspective. Is there anything else you'd like to add?
Yes, actually, I wanted to just say that the work that I've done with in the realm of substance use has really brought me closer, and I think I can speak for my team. It's really touched us and brought us closer to the topic. We've all learned a lot. And so we're able to bring more humanity to this work and kind of spread that. So we really are honored to do the work and to work with the folks across the spectrum, folks who are kind of on the ground, folks with lived experience, and bringing in folks who haven't learned that language yet or haven't noticed to make any adjustments. We hope that that is kind of spreading through the work that we do.
Thank you so much, Aria, for sharing your views on stigma. And thank you to our viewers for watching. Speak Out on Stigma is a forum to raise awareness about the harmful impact of stigma on those in and seeking recovery. Recovery is for everyone. Together, we can eliminate stigma. Don't forget to like, comment, and share this video. Thank you and have a good day.